Namaste and good afternoon. Welcome to a special Facebook Live session presented by Apollo Hospitals. Dr. Srinidhi Chidambaram here. We must remember that good health means that all the various organ systems in our body are working without disease and in optimal condition. One essential organ that we need to know more about is the liver. The liver is an essential organ performing hundreds of functions which are necessary to sustain life. Weighing on average about 3 pounds in an adult, the liver is one of the largest organs in the body, and it's truly an amazing organ because it has the capacity to regenerate, which means that it can grow back after injury or surgery. The liver, however, can be affected by a variety of factors that can damage it, like the viruses or genetic diseases or alcohol abuse or obesity and many more. And over time, they can damage the liver, leading to what is called cirrhosis. It can lead to liver failure, which is a life-threatening condition. But early treatment and recognition of the early warning signs of liver issues can give the liver time to recover and heal without any issues. So I'm sure you'll agree with me that it is very important to know all about the liver and liver disease and liver health, as there are specific ways in which we can ensure that our livers are healthy. So, to discuss this with us and give his valuable opinions, I'm very happy to welcome Dr. Vikram Raut to this discussion. Dr. Vikram Raut has an MBBS, MS, and a fellowship in liver transplant and hepatobiliary surgery from Japan, France, and South Korea. He is a consultant in hepatobiliary and liver transplantation at Apollo Hospitals, Navi, Mumbai. He has extensive experience in living donor liver transplantation and a cumulative experience of over 1,000 liver transplants. He completed his surgical training at the BYL Nair Hospital, Mumbai, and went to Kyoto University Hospital, Japan for his fellowship in liver transplantation, has had training in liver transplantation and hepatobiliary surgery in France and at Seoul in South Korea. Recently, he also completed robotic and laparoscopic liver surgery training at Yonsei University and Seoul National University in South Korea. He has received numerous awards, and some notable ones are the International Travel Scholar Award in 2010 by the International Liver Transplantation Society, the Takeda Science Foundation Scholar given by Takeda Science Foundation, Osaka, the Young Investigator Award by the European Association for Study of Liver Disease from Germany, Travel Award at Japan Surgical Society's annual conference, the best presentation from the National Conference of the Indian Association of Surgical Gastroenterology, and many more. Welcome, Dr. Vikram Raut, to this session. And I'm very happy that you have taken the time off from your very busy schedule to join us. Let us begin with first going to the basics. And let me ask you, what does our liver do?
So, as you rightly said, the liver is one of the largest organ, and I call liver as a supercomputer. So it functions. It has more than 500 functions at a time in our body. These functions ranges from the various synthetic functions like liver synthesize very important uh, proteins like albumin, immunoglobulins in our body, which is responsible for functioning of our body. It also removes many toxins from our body, like the ammonia. So when the liver is not functioning, the ammonia accumulate and it affects our heart, our brain. Liver also functions, most important function is our digestion. So what is the metabolism? When we eat, every food is broken down into the energy and it gives energy. When goes into excess, it stores energy in from form of glycogen or in a fat. So these are very important functions for our day-to-day life that liver does.
So, I'm sure everybody wants to know. So, what can we do to keep our liver healthy?
So it is very important that our supercomputer needs to be working properly in day-to-day our life. So they're very basic things, as you rightly said. Liver has a huge regeneration potential. So liver can absorb some shocks and it can recover itself from them. It has a huge regeneration potential. But apart from that, it's very essential that we need to do certain important thing which that will keep our liver healthy in long term. So most important thing is, as you know, that the liver is very commonly damaged by a certain toxins. Like alcohol is the most common toxin. So you should avoid drinking excess of alcohol. Some alcohol is okay. The excess of alcohol is not good for a liver. Second important thing is you take some medicines in form of herbal medicines or Ayurvedic medicines, and it contains a lot of heavy metals, and that can cause a damage to the liver. Second important thing is you need to eat a healthy, balanced diet. Okay, nowadays a most common problem you see there, it's a fatty liver is growing. For that, it's very essential that you take a balanced diet, rich in protein, rich in fruits and vegetables, low in carbohydrate, and well balanced oil with a high percentage of polyunsaturated fatty acids. Another important thing is you need to do the regular exercises, which will keep your liver health in a balance. So these are a few important things which will you will be able to keep your liver in a healthy condition.
So today we all know about this term which people are very familiar with, the fatty liver. So what does that have to do with being overweight or obese, and how does that affect the liver?
Yes, you are right. The fatty liver is very growing problem, and it is almost said that its prevalence is almost 30%. So if you are three people in a room, one person has a fatty liver. So it is that common. And although fatty liver is one important thing, it's a reversible condition. So if you act, it can be reversed. And but at the same time, you also need to know that it is a very early warning sign for us, something we called as a metabolic diseases or metabolic syndrome. So these diseases are very commonly associated with obesity, with your diabetes mellitus, with your hypertension, and in long term, if it persists, then it can cause liver cirrhosis, it can cause cancer, it can cause various other health problem like a coronary heart disease, diabetes, chronic renal disease, hypertension, and that will have a very adverse impact. So it's very important that you need to be aware about fatty liver. If you are overweight, most of doctors will recommend that you need to reduce your almost 5 to 10% of weight, and that will reverse your changes of fatty liver. If you're drinking alcohol, please stop that. Ideal way, I will say that you need to check your BMI. You need to check your body mass index. So for every height, there is a corresponding weight. So you need to maintain your body mass index near about 25, which is ideal. If you cross the body mass index more than 25, you will be called either it's overweight or obesity. So it's very important that you need to keep your body mass index somewhere around 25.
So talking about reducing the weight and also about the diet, in your opinion, what would be the beneficial foods and what will be a good diet to have to maintain liver health?
So as I said, the balanced diet is one of the important component in keeping your liver health healthy. Okay, whatever the American Association of Liver Disease suggests that we should eat something called as a Mediterranean diet. So what is a Mediterranean diet? Basically, you feel your most of uh, your plate needs to be filled with fruits, vegetables, and the proteins. and the carbohydrates and oil needs to be supplemented. So you need to eat a healthy balanced diet from the vegetables. You eat proteins from paneer, be it chicken or fish. The protein should be almost 25% of your daily intake, and green leafy vegetables, your salad is important component. So this will help you not just to keep your liver healthy, but it's the same diet which is usually recommended for the prevention of obesity, controlling the diabetes, controlling the hypertension. So it's all up for something we call a complex called a metabolic syndrome. So if you control this, most of your diseases can be sorted out.
Right. So coming to the liver diseases, are there any groups of people who are at high risk for developing any liver disease?
So yes, the certain people are developing a high risk, and it's mainly largely because of they are exposed to the certain viruses and which cause the liver infections. So if you are eating a lot of outside food, which is not hygienic, you are prone for developing the hepatitis B, or hepatitis A, or hepatitis E infections, which can cause acute liver failure. So if you are taking drugs, or if you are taking intravenous injection at your own, or if you have a high risk sexual behaviors, you are very prone to develop the hepatitis B and hepatitis C. Other important high risk group will be the alcoholics. If you have a very high alcohol consumption, you have very high likely chances that you will develop the liver diseases.
So how does alcohol actually affect the liver, doctor?
So basically, a liver metabolize, as I said, whatever you eat, it metabolize. So the liver is also metabolize alcohol, and some metabolites of alcohol metabolism are dangerous to the liver. So what happens is they start damaging the hepatocyte, and it is going to be a over long period of time. So if you consume about 180 ml of alcohol every day for almost 10 to 11 years, then you will develop the liver problem. So initially it start with a fatty liver. If you stop alcohol and control your alcohol drinking, it still can be reversed. But if it doesn't, then it further progresses to the steatohepatitis and the cirrhosis. If you continue to drink alcohol for 10 to 15 years, you are very likely that you will develop the liver cirrhosis and go to the end stage liver disease.
Um, so what about other, when somebody has maybe like a higher cholesterol, or their lipid profile is abnormal, or they have kidney disease, or they have diabetes, what are their chances of the liver also being affected?
So what you are telling that all component, as I said, they are a component of the metabolic syndrome. So these basically are interlinked diseases. A person who has a diabetes will have usually have maybe overweight, or they will have a hyperlipidemia, and it is the same spectrum of disease. So when you have a high cholesterol, due to obesity, or due to in case of a diabetes, the same fat is going to be deposited into your liver, into your blood vessel, into your pancreas, and it triggers the same chain of reaction. And if you will have fatty liver, you have coronary artery disease, you have diabetes mellitus, and a kidney disease. So that's why it is very important. And as I said earlier, the fatty liver is in fact the early warning sign. If you diagnose and prevent it, you can prevent multiple other diseases like diabetes, hypertension, coronary artery disease.
So now we will come to actually when the liver is being affected by any of these conditions. So what would be the earliest warning symptoms, or what are the common symptoms of the liver getting damaged?
Yeah. So unfortunately, the God has given us a too big liver. We actually need just a 30% of liver for our normal functioning. So it's the liver's symptoms are usually very late. So it's very essential that you need to do the regular health screen, and even a minor changes which can be picked up early and if you diagnose the liver disease early, that is very essential. Usually what symptoms you get when the liver is damaged more than a 70%. Sometimes liver can recover itself, or sometimes it may not recover. Depending upon, we call the category of liver disease either the acute liver failure or a chronic liver disease. So most common symptoms of liver damage is the jaundice. So you will develop the yellowish discoloration of your skin and eyes. And if you do the blood test, your bilirubin will be increased. So that is called as a jaundice. Another symptoms you may develop the due to liver disease is swelling of your legs or swelling of your tummy because of accumulation of water in the legs and into the abdomen. uh, Features of a chronic liver disease sometimes include the vomiting of blood, or you may pass blood in a stool. Sometimes you develop the unconsciousness or confusion state, what you call hepatic encephalopathy. So these are various symptoms. You will have a tendency to develop bleeding easily because your coagulation profile is deranged because of liver disease.
So in India, according to your, I mean, you've had so many years of experience as looking at the liver diseases. So what are the common causes of liver diseases? And even children get affected, isn't it, with liver diseases? So what are the common causes we see here in India?
Yes, so you're rightly said the both the children's and as well as adults are affected due to liver diseases. Most common liver disease we see in the children is biliary atresia. It is basically the genetic developmental disorder when the bile ducts are not developed in that kid, and they will develop the jaundice, and it needs to be diagnosed early, and there are various corrective procedures available for a treatment of biliary atresia. There are certain genetic disorders which are more common in children's, and because of that, the patient with children's will develop the metabolic liver diseases. The most common liver diseases in adults are either with hepatitis viruses. So hepatitis A and E virus cause acute liver uh, uh, hepatitis, and they are usually self-limiting, but sometimes they have a worse course also. Other hepatitis viruses are hepatitis B and hepatitis C virus. They usually cause a long-standing liver disease, what we call as a chronic liver disease. The alcohol is another important cause for a liver disease. And nowadays we were discussing the fatty liver and diabetes, which is very commonly associated, something we called as a non-alcoholic steatohepatitis. And it's now the rising cause of liver disease in India and across the world. Other some causes of liver disease are autoimmune liver disease, where liver body cells act against our liver and damages the liver.
You already mentioned, doctor, about this people taking supplements and alternative medicine treatments, Siddha and Ayurvedic medicines, and even sometimes a lot of, in India, we have a lot of over-the-counter buying of medicines from
Yes.
pharmacies. So could you tell us a little more in detail about what people must be careful of? Because many people do not know that it can actually cause liver damage.
So, as I said, one of the important function of our liver is metabolize toxins also. So, whatever we eat, it first goes to our liver, and then it is metabolized. But in that process, sometimes these toxins do harm the liver. The most common over-the-counter drug which is available in India and worldwide is a paracetamol. If somebody takes the paracetamol at very high dose, It can cause the liver failure, and sometimes we refer that as acute liver failure, and patients sometimes need a liver transplantation. So the paracetamol is most common over-the-counter prescribed drug which can cause liver diseases. Apart from that, there are many herbal medicines or Ayurvedic preparation. They do have heavy metals as their component, and it can also cause a liver injury over the long term. Or sometimes if you have a borderline liver disease, it can be aggravated due to these medicines.
Sure. Um, is there any way to, prevent, apart from all the lifestyle modifications, when it comes to hepatitis? There are vaccines available, but what should people know about it, and how important is the vaccination?
Yes, so as we discussed, there are few hepatitis viruses where it can cause acute or chronic liver disease, and we can be protected against them if you vaccinate themselves. And vaccine is very effective against the hepatitis B virus. So we need to take the hepatitis B vaccine, which could prevent you from the chronic hepatitis B infection and sometimes from the liver cancer also. Hepatitis A vaccine is also available, and hepatitis A vaccine can prevent or protect you from the acute viral hepatitis, and it usually needs to taken at frequent interval.
What about hepatitis C? Is that entity in India, and is there any way of preventing it?
So, hepatitis C is a component of hepatitis viruses, and it is usually transmitted by a blood-borne infections. So, if you are taking sharing needles to take IV medicines, or sometimes the in earlier days it used to transmit it through the blood and blood product during the surgery or during the operations. If you are sharing the razor blades, it can be transmitted. It usually causes the chronic liver disease. That means the liver is damaged very slowly over a period of 10 to 15 years, and it can lead to cirrhosis and the liver cancer.
So, this word cirrhosis is also something which people are very familiar with. So, what is cirrhosis, and what happens what happens when the liver is affected by cirrhosis?
So, in the beginning, you said that liver has a huge regeneration potential. So, any toxin or any in form of alcohol or heavy metals, or sometimes in form of the viruses, when they attack the liver cell, what it tries to do is it heals and it regenerates. Okay, but normally, if you, I will give you example, like if you have a cut on a skin. Okay, so it heals, but it heals with a fibrous tissue or something we call as a scarring. But if you have multiple scars on your skin, eventually what will happen? So there will be a no normal skin left, only the scar tissue. So when this alcohol or viruses or any autoimmune process, there are repeated damages over the period of 10 to 15 years. What happens is only the liver, normal liver is turned into just a scar tissue. So that is what we call as a liver cirrhosis, where we have only a fibrous tissue and very limited functioning hepatocyte, and that's why we develop into the liver inefficiency.
So this then comes to the liver transplants. So at what stage does one qualify for a liver transplant, and is it like for all cases of liver diseases?
So basically, as we discuss the various spectrum of liver diseases, the certain liver diseases, as we talked, that are self-limiting, like a hepatitis A infection, and patient will recover by itself. There are certain liver diseases where it causes acute liver failure and where they have very high risk of mortality. In certain cases of chronic liver disease, as it progresses, we initially treat with the medicines, but they will come to the certain stage where the medicines are either not effective or they are developing some complications to that. In these patients, we need to consider for the liver transplantation. We usually calculate something called as a MELD score, and if it is a MELD score is more than 15, we usually recommended liver transplant for these patients.
So the final question is about liver cancer. So what are some of the causes, and is it potentially curable?
So the liver cancer is one of the most common cancer, and it is worldwide. It is the fifth common cancer in the male and females. Uh, it is usually caused due to the patient who have underlying cirrhosis. So patient with a fatty liver, long-standing fatty liver, or patient with hepatitis B or hepatitis C, or for that matter, alcoholic cirrhosis, over the period, they can develop the liver cancer. So it is very essential if you have a chronic liver disease, you need to have a regular screen in terms of the liver imaging, like ultrasound at CT scan at regular interval, or by some tumor marker like alpha fetoprotein, which will fix this lesion at early stage. And if you diagnose at early stage, you can have a very good cure in terms of a liver resection or by a liver transplantation.
So thank you so much, doctor, for your valuable opinions, and I'm sure our viewers have now a very clear idea about liver disease and liver health. Thank you so much for that. So, dear viewers, the message here has been that we need to take our liver health very seriously. And many times when we discuss health, the liver is often overlooked because we are always talking about the heart or the brain or the lungs. But the liver is a workhorse organ with many important functions, as the doctor said. And since it is quite a large organ, symptoms do not manifest till very late. But we know that the liver can do its job best only when we take care of it with very healthy lifestyle choices. So do take care of your liver so that it takes care of you all your life. Thank you so much and see you soon. Namaste.